Bipolar disorder is a psychiatric health issue. It is a psychiatric illness or disorder. It is characterized by, like the name suggests, somebody having two poles in their moods, of which one is depression, where one would have low mood, decreased interest in doing activities, decreased energy levels, feeling more fatigued, less interaction happens when one is feeling depressed, not wanting to initiate conversations or activities, having a lot of dysfunction in their life in terms of their professional as well as personal life, negative thoughts about oneself and others. These are the symptoms which one would experience in the depressive episode of bipolar. The other pole of bipolar would be a manic episode, where it would be slightly more or less opposite of depression, where they would have an inflated sense of self, they would think highly of them, they would have increased energy levels, they would have decreased need for sleep, and the mood will be either very happy, cheerful, euphoric, or it would be irritable and angry and aggressive. So when somebody has an episode of depression followed by an episode of mania, or vice versa, that is an episode of mania followed by an episode of depression, we can say that okay, this person is having bipolar disorder. Usually we also need to ask about the family history, because that gives an idea about if they are prone to developing bipolar disorder, because it is something which is genetic. Also, by the way they are talking, by the way they are dressed, by the way they are expressing their thoughts and their feelings, that is an indication to where do we need to focus, what could be the possible diagnosis, and then we can identify them and sort of take them to a mental health professional and help them like that. Now, when one is having bipolar disorder, the treatment which can be given to them, or how can one be helped when they are struggling with bipolar disorder, is by taking them to a mental health professional, which is very, very important. You should never diagnose somebody with bipolar disorder until and unless you have proper history from them, and the diagnosis can be made only by a mental health professional, a psychiatrist or a clinical psychologist. The treatment would involve extensive history taking, understanding what phase of bipolar are they in. Are they in a manic episode? Are they in a depressive episode? Depending on that, starting medications, that is pharmacotherapy. What sort of medication do we need mood stabilizers? Do we need antidepressant medication or antipsychotic medication, or do we need more of psychotherapy, and at what stage do we need to start the psychotherapy? If somebody is having a significant amount of dysfunction diagnosed with bipolar disorder, in the initial stages, therapy or psychotherapy might not be the way to go about the treatment. They would require medications and pharmacotherapy, followed by psychotherapy when they are slightly more stable and in a state to understand that okay, this is what we are experiencing, this is how we can take care of ourselves, and this is how we need to go on here on forward to not have these kind of problems in the future. So that is what we can do.